On the pulse today, we start with a strike action by the Ghana registered nurses and midwives as it continues to bite hard on healthcare delivery in many parts of the country. The emergency ward of the Wa Municipal Hospital is one of the health facilities that has remained closed. Let's cross over to the region to speak to our correspondent, Rafiq Salam. Rafiq, what's the latest from the Upper West region?
Are you hearing me now?
Yes, very clear. Thank you, and proceed.
I'm saying that the strike in the Upper West region, to be precise, at the Wa municipality is really biting hard. Let me start with the Wa Municipal Hospital, where I can report to you that the emergency ward of the hospital remained closed since yesterday. The nurses, after they tried to embark on the strike to at least withdraw services from the emergency services and the OPD, they went on to put a locker on the emergency ward. And so the patients who were at that facility, they managed to at least, after they took care of them, they took them to the, I'm told that some of them went home and some of them also went to other facilities. And so because the place was empty, they managed to put the place under lock and key. When we went to the OPD session of the hospital yesterday, there was only one nurse that was remaining at the place. Today, I can report to you that all nurses at that particular place, because I'm told that there are half a dozen of nurses who are always in there, but today they were not there. The place was completely deserted. I can only count as many as 5 patients who were sitting on at least on the chairs, and also some also on the metal chairs. Also, they were the only people there. So they said that they came to the hospital. They were told that the strike was ongoing, but they haven't seen the nurses.
Okay, Rafiq, some days ago, we reported that some other nurses who do not belong to the Ghana Registered Nurses and Midwives Association were stepping in to help. It appears today we don't have that situation. But what I'm curious to know is that over here in Accra, especially at the Kolebu Teaching Hospital, some doctors have stepped in providing services for patients. Is that the case at least in the Upper West region?
That is really the case at the Upper West Regional Hospital. I spoke to the acting medical director of the hospital, Dr. Philip Babine, and he told me that what they have done is that they have made some medical doctors who were on leave to capture the leave to come back and then to attend to these patients. And also here, the doctors are also performing dual roles. There were some of the services that were provided by the nurses this time on. It is the medical doctors who are really taking up these positions. But somebody will will even tell you that in the Upper West region, for that matter, some of these critical, health staff are not in there. So already Upper West, the doctors or also the nurses are not in there. So if they are striking, that means that it will have a lot of impact on our people. Secondly, what the medical doctor also told me was that they are also now relying on the services of nurse trainees at the Upper Hospital. They are voting about 99 nurse trainees to augment, at least so they won't have that impact. And also, they're also using some rotational nurses, which they will be paying at least, which they will be giving them some allowance at least to man those positions until the strike is over.
Okay, Rafiq, that's good to know. Again, some days ago, we reported on a woman with a snake bite, you recall, who initially resorted to traditional medicine, but luckily you had to call her back because some nurses who did not belong to this mother body were ready to help with the situation. Tell me the situation with patients who are coming in and are walking in. What other option are they resorting to? Is it traditional herbal medicine? Is that the case?
The situation in the Upper West region, I can report to you that it's really dire. Here, we don't have many private facilities as in the case of other regions in the country. Here in the Wa municipality, I can only tell you about one facility, Homeland Clinic, where all the patients are now gravitating towards, which is also from the heart of town, close to about 4 kilometers from the heart, about 3 kilometers from the heart of town. And so that is where all the patients are now. So if you go there now, the place is really inundated. There are a lot of maze of patients crammed at that particular facility. So there's only one facility here, which is private. As I speak to you now, currently, behind me is a AZD Yobet hospital, and I tried to check in there. I can see that only few people who are part of the UPNMG, they are the only ones working, but the rest that belong to the GRNMA are not working. So here, the services is not full, and then you can, and most of the parents, most of the patients are being turned down. They have been asked to go to town. When they get to town, yesterday I bumped into one of them who came, who had a boat accident and went to the one municipal hospital, where luckily on his path, he got one of the striking nurses, at least who came to him and then also to dress his wound for him. So that is really the situation in the one municipality.
Thank you so much, Rafik, for bringing us updates from the Upper West region, particularly Wa. Now, still on the health sector, especially on the striking nurses, the minority on the Health Committee in Parliament has accused the Mahama-led administration of acting in bad faith for failure to resolve ongoing nurses' strike. Members of the Ghana Registered Nurses and Midwives Associations have, over the past 1 week, laid down their tools to pile pressure on the government to implement the improved conditions of service signed last year. A number of engagements in the past few days have since not yielded any solution to the matter. Speaking at a press conference in Parliament, the minority first accused the government of acting in bad faith, the reason for the undue delay in implementing the agreement. Nana Eyu Afriye is ranking member on the Health Committee.
You may make an argument that the essential health workers, but the same Act 625, that's Section 10, that says that they are essential workers. And for that matter, if they want to resort to strike, they would have to write to the Fair Wages Commission. They notified the Labour Commission and the Fair Wages. They did so, Labour Commission. They gave them a letter, and then in the same act, they're supposed to respond within 48 to 72 hours. You did not respond to it. Bad faith from government. Extremely bad faith from government. And then now you, the same Labour Commission, then take them to court, referring to the same act that says that essential workers do not go to strike, do not strike. Again, another bad faith. So you are using your powers to checkmate them, while the same act gave you the mandate to have resolved their issue within 72 hours. You did not. We in minority don't believe that the nurses are at any fault. It is their right. They are seeking their right. I would want to know any of you who think this just is not justified in Appendix A of their CBA. Which of them? Is it the 30-month allowance, which has been agreed that is being paid under the previous government? Is it the issue of rural incentive allowance that was agreed, that is meant for nurses and midwives in the rural areas, so that we can have nurses and midwives in the rural area? Which of them would you say is not legitimate? Is it the issue of fuel allowances, which has been historical since 60s for these people? Is it the issue of uniform allowance, which has been there since the 1960s? It couldn't have been changed in any republic, and it cannot be changed under a previous government. It cannot be changed now. So you see that all the expectations in the CBA called for in Appendix B is justified and not far-fetched. But government has not seen the need to have engaged them since January. They feel undermined as far as their rights are concerned. And that is why they advise government that, okay, we're going to wear red bands for the first stage. The next stage, we're going to do OPD. And the next stage, IPD, inpatient. And now, total strike. And nobody was listening to them to have taken them to court. Even taking them to court is an extreme act of bad faith. You don't. Everybody is being assertive. They have their rights within the law. You cannot use the law to checkmate them. That's not right.
Now, they've called for an immediate resolution of the matter to allow the nurses return to work.
Here, to state clearly that the posturing of government must change. It must change. Respect them. Sit with them. Let them know what you can do and what you cannot do. Luckily, we are going to listen to the Minister of Finance soon on the media budget review. So this is the time that you have to include their concerns as far as the media budget review is concerned. It's not as if we are in August, then you tell them, hold on for the next budget cycle. You are now going to read the mid-year budget review, and this is the right time to include their concerns, or this is the right time you listen to them. My understanding was that since January, they were told that the Ministry of Finance will meet them in June. And then the date was June 18th. How would you feel when you want something and somebody is telling you that, hold on, 6 months' time? How would you feel? We are not here to justify the strike for them. We are here to plead with the nurses to understand that even if governments see the need to engage them, they should go with the good faith with Ghanaians at heart. Because getting all the money without the lives that we have lost brings no joy to anyone. So as minority, we are mindful of the fact that we are not stoking it up and asking them to prolong the strike. We are only asking them to be merciful as far as the tables are concerned, that when they go to sit, they must be merciful to see the need to be reasonable. Reasonability means you appeal to their conscience and say, if you are asking for 8 things, we cannot. You know what? In the budget, we'll do 3. Maybe the next budget we'll do 2. Let government change their posturing towards these people and let them not use the law and let them not frighten them. You hear they say that the president is married to an MPP person. You are just making this one so below the belt. The same president was the one who called the nurses' strike in 2020 for 3 weeks. Wasn't he married to an MPP person? Why do you politicize this? He's the president, for crying out loud, and has a right to make sure the welfare of his people or her people are held up high. Would you want to politicize everything to the point that people are losing their lives? The next life that will be lost is my relative or your relative. And we are not here in minority to do a business of politics on health here. We are not ready. We want to call a spade and just ask government to change their posturing. Show some respect to the nurses and midwives of this country. And then tell them something better, so we can also urge the nurses to be more merciful to Ghanaians as their rights are being respected.
The government has issued a desperate plea to retired nurses and midwives, urging them to step in and help alleviate the country's healthcare crisis. The appeal followed a collapse in yesterday's emergency talks with the Health Ministry after leadership of the striking nurses and midwives flatly rejected the government's request to defer their new conditions of service to 2026. At a hurriedly arranged news conference at the presidency, Health Minister Kwabena Mintah Kando announced that the government will soon publish a list of health facilities for patients to seek health care and recruit retired nurses and midwives as part of emergency measures to be rolled out to mitigate the crisis.
While working around the clock to resolve the impasse, the Ministry of Health has taken the following steps to mitigate the suffering of Ghanaian patients unduly affected by the strike. The ministry will, in the next few minutes, publish a comprehensive list of facilities to complement facilities where nursing services are lacking and where patients can seek health care. Given the urgency of the situation and suffering of the patients, government appeals to public-spirited retired nurses and midwives to volunteer their services for a brief period pending the resolution of the impasse. We further express our deep appreciation to practicing nurses who have opted to remain at post to help suffering patients and urge others to show similar fellow feeling and assist our ailing compatriots, even as efforts are made to address their concerns.
The government claims that meeting the striking nurses' demand will require a staggering 2 billion cedis, throwing the budget off gear, sparking a big debate about priorities and resource allocations. Now, here's Dep Finance Minister Thomas Nyako Ampim.
The reality is that we have over 120,000 nurses, and the implementation of the current condition of service that they are demanding will have serious consequences for the budget. In fact, if we fully implement it, we are going to add in excess of 2 billion cedis to the compensation budget. We have all committed that in our resolve to reset the economy of this country, we must maintain a 1.5% primary balance surplus every year in order to bring our debt levels to sustainable levels. And so it is important for us to manage expenditure.
However, the striking nurses leadership has fired back, revealing a deeper issue. General Secretary of the Ghana Registered Nurses and Midwives Association, Dr. David Tinkran, says many retired nurses are impoverished and harboring anger due to unfulfilled promises. He spoke on Newsdesk earlier.
I don't think this is a very good position. I'll urge the Finance Minister respectfully to relook at the figures. What is it in the condition of service that will throw the budget of Ghana off jail? It cannot be said to be true. As far as we are concerned, I think that they need to come clean. They need to prioritize the health needs of the good people of Ghana. They need to prioritize the economic interests and economic welfare of nurses and midwives. And I've been told that one of the mitigating factors is to deploy retired nurses and midwives. They are more even angry than us. What they don't know is that the retired nurses and midwives feel that they've been let down by the state. Okay, I visit them from time to time, not just individuals, but if, for instance, I can show you a place that they meet every last Tuesday of every month. They meet at Christ the King. Go there and talk to the retired nurses and midwives. Some of them have been affected with occupational-related ailments, disease conditions that they got whilst working as nurses and midwives. And they're at home, and their retirement package cannot even buy them the little medications that they need to.
Now, still on this, the striking nurses leadership paints a disturbing picture of retired nurses struggling to make ends meet. Their anger simmering due to broken promises. This revelation adds a personal dimension to the crisis, highlighting the human cost of policy decisions. Well, a labor consultant, Austin Game, has been providing some options on the way forward.
It is normal. It is normal when you negotiate and you have a hiccup along the line. You have to get together and have a conversation around the subject matter and find a solution. Section 108 of the Labour Act enjoins parties to know that there will arise disputes, not only during, after the negotiation, but implementation period could, hit a snag. And both parties will have to consider that as differences, come together and have a conversation around the subject matter. If you go debating and arguing for a one-sided solution, you will never get the desired result. So I will urge both parties, especially my friends, the nurses, to go back to the National Labour Commission, where they will be assigned experts to guide both parties to enable them to reach agreement, because the way out for them is not to be on strike now. I think I've spoken to the General Secretary this morning online that they should go back to work, because they will not be the winners. The employer will not be the winners. Their customers, the patients, who in diverse ways, together with all of us, contribute to paying their monthly wages, they are the people who are now victims of the circumstance in which we all find ourselves. So I will plead with them. They should go back to work. They will sit down and iron out the differences.
Now, Kofi Ajay joins me in studio. Why? Because government says that implementing the nurses' demand could cost 2 billion cedis a year. Let's try and understand how significant this amount to the budget that was read earlier this year. Tell me, is this significant?
Well, I mean, the healthcare budget is one of the biggest in terms of compensation of employees, and even looking at the budgetary, expenditure line items. What we've been trying to do is to look at this 2 billion Ghana cedi in proper context, where this amount that we are talking about is about 2.6% of the total compensation of employees, budget for 2025, and just about 0.68% of the total, expenditure, amount that government wants to spend in 2025. If you drill down further and look at this year's healthcare budget, it's somewhere around 17.8 billion Ghana cedis. That means that this figure will be around 11% of that. And what we are understanding is that if you look at government's budget this year, there is a clear indication that one key item that they are looking at and would not want to go up is the compensation of employees' budget, which includes wages and salaries, gratuities, and other social benefits. They are pegging this figure at some 76 billion Ghana cedis, and in fact, they do not want this figure to go up. If you want a clear indication, and possibly one of the reasons why the nurses may be angry is the fact that if you look at the, over the years, how healthcare budget has been changing, you could see that this year is sort of an outlier, where in 2020, for instance, during the COVID period, when we had healthcare budgets going up by some 22%, it's been up, every year it goes up by that same margin, around 22% every year. Then we saw, that stratospheric rise in 2024, where these 8 agreements were actually reached, healthcare budget going up by some 48.5%. And this year, if you look at the trend so far this year, we're expecting that healthcare budgets will rather go down by some 0.26%, which means that government is really taking a stance and saying that, look, we have a very tight fiscal space in 2025. If you look at our interest payments this year, so high, and if we decide to implement this 2 billion, addition, it could derail our budget. But what we understand is that if you look at the healthcare budget, for instance, the biggest component is their wages and salaries, which is usually around 70% or 68 to 70%. And the nurses were clear that these 8 demands that they have tabled, and according to them, agreements have been reached, they feel that they do not want to go back to the negotiation table anymore. What they are looking for is implementation. And that is the only thing they are calling for. And they are not ready to go back to the table again to relook at the agreements. They say that these 8 agreements that were actually agreed upon in 2024 or last year should be maintained. And governments should now start thinking about how to implement them and not, renegotiating. But government is making a big point that if we decide to go ahead to implement this, we will require some 2 billion Ghana cedis in excess to actually implement this. We have done the math, and we say that if government agrees to do this, that could cost government some 167 million Ghana cedis every month to implement these 8 agreements that were reached in 2024.
What's the difference then would be how much the government is projecting they'll be spending?
Government is projecting that the entire year should be around in excess of 2 billion.
2 billion.
And we have done the math, and we've realized that if government should go ahead to implement this in full, they will require some 167 million Ghana cedis to fully implement this. But of course, another leg to this whole conversation is whether the nurses are ready for these demands to be implemented. They are not even demands, they are agreements now to be implemented in a stagger process or in bits.
Yeah.
But we understand that what they really care about is that going forward should be implementation and not going back to the negotiation table to talk about revising, what we agreed on. And what you find on the screen is that staggering number where, according to the Ghana Registered Nurses, the Midwifery Association, according to them, they have about over 40,000 members. And if all of these 40,000 members are on strike at the moment, then that should tell you that already, worse nursing to patient ratio of 1:600 patients will be, skyrocketing at the moment. And possibly there's a reason why government is saying that, look, they need some sort of intervention. But people are saying that, look, this could be just voluntary work, but is government going to pay allowances? And how much is going to cost government to bring back or to recall retired nurses or bring back volunteers? Why not look at, look at the low-hanging fruits, maybe in the 8 agreement that were reached, and possibly start the implementation? And the reason why the nurses are so keen that they could get the green light from government is that they know that the mid-year budget is some few weeks away.
Okay.
And if you don't push it to get it into government books, then it means that you have to wait for somewhere November for 2026 budget to be read. And many have made the argument that if government is promising 2026, the books or the numbers do not look good in that year as well. Because if you look at some of the amortizations we've been paying in 2026, very, very huge. And if government is now crying over debt servicing, that debt servicing is going to get worse in 2022. So what is the assurance that nurses could get these 8 agreements going through next year, Mefa?
Honestly, if this figure wasn't this significant, I was going to ask, in my little, accounting, when you're preparing your budget, there's a thing called miscellaneous. There's some small money you hide somewhere for, challenges like this for you to meet. But this is quite significant, and I really doubt that government may have made some money available to want to mitigate such challenges.
But of course, government itself is running deficit.
I understand.
What it is hoping to spend is more than what it's hoping to rake in as revenue. And we've been talking about CD appreciation, and we say is positive, but that actually affects government's revenue. And many have said that could be the reason why the president actually gave a range where he feels that the true value of the CD should be, and it should not be below 11 CDs, because government knows that although this is positive, Ghanaians are actually jubilating. Deep down, it is a big blow to government's revenue for 2025.
Kofi, thank you for crunching those numbers. But stay with me. Let me go on phone now and bring in Dr. Nana Afriye. He is ranking on the Health Committee in Parliament. Thank you for joining us this afternoon. So you're calling on government to implement these agreements because you think that they are acting in bad faith. You have seen how much it will cost the government. Is this a realistic call to the government? Okay, we'll try and reconnect with Dr. Afriye again, but let's engage the Chief Executive Officer of the Fair Wages and Salaries Commission, Dr. George Smith-Graham. Thank you for joining us this afternoon. I want to understand how easy or difficult it's been so far in trying to engage the striking nurses.
Thank you very much, and good afternoon to your viewers. We've started engaging. It's not difficult. We've started engaging. The most important thing is for them to call off the strike. We've appealed to them to call off the strike, and once they call off the strike, we'll continue our engagement. It is important that we all understand the circumstances that has led to the situation. It is no fault of anybody that we've not been able to implement the conditions of service up to today. Because like you all know in the media by now, the conditions of service was signed in May 2024. And then by July 2024, it was sent to government for implementation. But just around that same time, government was injuncted by a court injunction not to implement the conditions of service for the signed conditions of service. The reason being that there was a court case, and the court case has to be dealt with before government pays or implement the conditions of service. So government was injuncted, and the fair wages was injuncted. Everybody, all the institutions supposed to implement the conditions of service were injuncted. And so we could not implement the conditions of service. And the court case dragged on until January 2025, when they concluded the arbitration. And after that, they wrote to us, Fair Wage and Sales Commission, to implement. But February 2025 budget, I think, was far in advance. And so government could not incorporate that in the 2025 budget. It is not only central government that could not incorporate it in the 2025 budget, but none of the teaching hospitals were also able to incorporate it into their budget. So that is a challenge. And It's the reason why we are engaging them to see how best we can do some shifting of the period of the implementation of the conditions of service so that they can enjoy the full benefits of their conditions of service, and government will also have the fiscal space to be able to manage the economy.
Dr. Graham, and so it appears that there's a stalemate, obviously, and you have just walked us through the detailed procedural processes that you have been through for, especially for fair wages and salary. I know that now, in the media at least, and engaging with the striking nurses, it looks as though they're going the full wire. You have said that you're still engaging them. In this engagement and in these negotiations, what are your real options on the table that will really get them back?
Our options on the table are two. One, call off the strike, come back, let's continue the engagement. That is the first one. The second one is that these conditions of service were signed in May 2024. Now, if it is not budgeted for, our proposal is that let's shift the period of the implementation to January 2026, so that the expiry date of the conditions of service can be shifted to December 2028. So you will enjoy the full 2 years of implementation of your conditions of service. And government will also have the fiscal space. The reason is that if we don't do that, the conditions of service is just for 2 years. If we go 2026 and we decide to even stagger the payment of the arrears, by March or April 2026, it means the government would have finished paying them the arrears from 2024 May. And by May 2026, the conditions of service will expire again, and we need to go and renegotiate. This is the danger.
Okay.
And this is something that will bring a huge, fiscal implication on the country. And that's the reason why we are saying that, because the delay of the implementation is no fault of government, but as a result of your own litigation and injunction, let's shift it to January so that you can have the full implementation of your conditions of service. And then government will also have the fiscal space. So these are the concrete proposals we've put on the table. According to them, after the meeting we had with them yesterday, because we managed to bring all the stakeholders on board, from the child to GES to all the teaching hospitals. But according to them, they cannot take that decision, although they rejected the proposal. But they said they cannot take that decision until they go to their council. And so they'll go to their council and communicate to us. As I sit here now, I have no communication from any council as to the decision they have taken. And so that is where we are now. And we'll continue to appeal to them to call off the strike so that we can continue the engagement.
Okay, Doc, I'm curious though. So just today, the government seems to want to, having a sudden appetite to engage retired nurses and midwives to want to set in and help the situation. Does this disrupt any of the processes or any of the tools that you have put on the table, negotiating instruments? Does it disrupt it in any way?
Not at all. Government, as a government, will need to find a solution to the problem, because people are going to the hospital, people are struggling. So government is finding a solution to it. But we, as Fair Wages and Salaries Commission, will have to continue engaging. Okay. And so whatever decision government is taking does not affect our engagement.
Okay.
But it's important that once there are rules and there are laws governing negotiations and everything, we cannot continue engaging when they are on strike. That is why we keep appealing to them. Call off the strike. Come, let's continue the engagement.
Okay, thank you. Let me bring in Dr. Nana Ayu-Afriye, your ranking for the Health Committee in Parliament. And thank you for joining us this afternoon. So you've been saying that the government is acting in bad faith. You've actually heard what the government says that it will cost the government about 2 billion cedis, staggering 2 billion cedis, and it will throw off government's budget off gear. The call on the government mitigating the problem, is this realistic? Do you think that the government is in the position to really pay or stagger off the 2 billion cedis to enable them have their health workers go back to the health facilities?
I'm unable to stay longer on the conversation because I have to make a statement on the floor on the same issue.
That's fine.
Governance is a complex process. I'm not here to justify for government its position. It's the responsibility of government to fix it, and they have to fix it. And how they have to do it, they got to fix it. As long as they have a CBA, that's their right. And as of how they will fix it is their responsibility. Our position on our statement today is clear. That if we will have understanding of the Kilman's communication or sophistry for solving conflict, two assertive people cannot be able to do anything better. It's the ground that suffer or the people in the midway. The things we did today was clearly to communicate government position and posturing since January. One of a kind that we are not happy with, especially when it's got to approval and payment from finance to controller. That's the issue. Two, we are also clear in our mind that the nurses will have to be merciful in our position when you go to the, if government sits with you and plead to you, nurses will have to be merciful and just try to know that the joy of your work is healing and not when we are losing more lives. Now, we are also not going to play more lives lost to the deterrent of their own right. No, that's not going to be the way to go on this issue. So it's more of a checkmate position, a difficult one, a chicken and egg one. So what we are asking of government is get to the nurses, let them know this, you're going to have the mid-year budget review. Let them know which of their concerns in the Appendix B on the CBA you can take on board, which of them you can take at the end of the year in the next budget cycle. So talk to the people. Let them have a feeling of respect and you are accommodating their concerns. And that's it. Then we are also asking the nurses to cooperate so we can get off this hurdle because nobody's satisfied or nobody seeks joy in seeing that people are unwell, having the difficulty of losing dear ones. We are not ready to play politics on that. I said it clear, and I will not do that. But I'm not going to also treat government with kid gloves on this issue. Whatever you've asked me, I cannot speak to it, but they have been elected to fix the problem, so they have to fix the problem. That's all I can say.
I hear you say that you're speaking on this particular situation, on this matter on the floor of Parliament. Is this the same recommendations you're going to be talking about in Parliament?
Absolutely, that's the same one. It's a joint statement, the same one. As a matter of fact, we commended the Ministry of Health, the Minister of Health, for his engagement, continuous engagement to them. The missing link is at the Ministry of Finance. The missing link is at the Ministry of Finance. That is where the missing link is.
So do I hear you say that at least a government's decision to want to defer the entire request to 2026, at least there's some part of it that they can include in the mid-year budgets? Is this what I hear you say?
Absolutely, you can. The research allowance, some of them, because talking to the nurses, we said, okay, granted 8 things, you don't get the 8, and they try to put some in the media budget, like research, like I think 2, 3 of them, some of them speaking to me, made a lot of sense. So for me, I think it's one of an ego power thing and not somebody is not doing. The same nurses are those who are commending the Ministry of Health for how they're handling their issue. Why are they not now upset with another arm of government, another sector? But for me, I don't know the difference between the Health Ministry and the Finance. What I'm saying is that the posturing on government is bad. They must show good faith.
Okay.
Yes, true. Nobody is happy about this standoff. Nobody is happy about it. I
really would love to let you go, but again, maybe finally. So the government says that it will engage the services of retired nurses and midwives, so at least to step in. I like to think that it will not be pro bono. It will still bring some cost. Is this something the minority?
That's not the solution. That's not the solution. That's not the solution. Retired nurses and co is not the solution at all. It's not a solution. It's not a way to go.
Okay.
You don't have to look at that point. Please, let me tell you something. If somebody is being too assertive, and anybody remain also assertive, there's continuous conflict. And we try to accommodate each other by descending into a spirit of cooperation. And when you get into that spirit of cooperation, they will see eye to each other. Bringing retired nurses, volunteers here is not a solution to this standoff. In any case, even if it's a solution, it will be a temporary one. It's unsustainable. So please, let us not go to that trajectory.
Right.
What I'm saying is that nurses listening to us, be merciful on the table. We respect your right. You are right to this decision. But be merciful to it. Government, speak to them, and they will respond appropriately. That's it.
Thank you so much, Dr. Nana Ayo Friye, for talking to us. But finally, I'll engage Dr. Graham. Thank you for holding for me. So you've heard what the minority's position is on this matter. They are asking that at least there's a little window, and so deferring it to 2026 is a bit far-fetched. How about the government considering this little window and input at least, not all of it, but part of the request in there? And many other things that he has raised. What's your reaction to this before I let you go?
The reaction would just be that we've not stopped the engagement. We are still engaging. But it is important that they call off the strike, because we cannot continue an engagement when they are on strike, and they know it. I've dealt with the leadership of the nurses for a very, very long time, and they know me. They need to come to the table. Let's continue the engagement. We've not stopped engaging. We should call off the strike, and when the strike is off, we can all sit on the table and then continue with engagement. That is my only appeal to them.
Thank you so much, Doc, for engaging us today on the poll.